Most people think they're basically the same pill with a different name, but here's the surprising truth. The choice between them can mean the difference between frustration and success, between an intimate moment that fails and one that restores confidence and connection. I'm Dr. Jenny Carter, and today I'll guide you through everything you really need to know about these two medications, how they work, the differences that actually matter, the mistakes that can sabotage your results, and how to know which one might be right for you. But before we dive into comparing them head to head, let's first step back and understand what's really happening inside the body when you get an erection. Because that's the key to understanding why these drugs work the way they do. When arousal begins, whether it's from what you see, feel, hear, or imagine, your body releases nitric oxide. Think of nitric oxide as the ignition switch. Once it's triggered, a messenger called cGMP floods the smooth muscles in the penis. This messenger relaxes the muscle tissue, allowing blood to rush in while the veins seal off, trapping that blood in place. The result? A firm, lasting erection. So what ends an erection? 3 things. The arousal signal fades, cGMP naturally breaks down, or your nervous system activates after ejaculation, causing the muscles to contract and blood to flow back out. Here's where Viagra and Cialis come in. Both drugs belong to a class called PDE5 inhibitors. PDE5 is the enzyme that breaks down cGMP. By blocking it, these medications prevent cGMP from vanishing too soon, so blood stays in the penis longer, helping you maintain firmness and consistency. Now here's the catch. While Viagra and Cialis work in the same way, their differences in timing, duration, side effects, and lifestyle impact can make one a much better choice for you than the other. Let's explore that. First, some common ground. Both drugs can cause mild, predictable side effects: headaches, flushing, nasal congestion, heartburn, and sometimes vision changes. Both must never be taken with nitrate medications, like nitroglycerin for chest pain, because the combination can drop your blood pressure dangerously low. And both should only be taken under the supervision of a doctor, especially if you have kidney, liver, or heart problems. Now, let me pause with a quick note. If you're finding this helpful and you'd like more science-backed, clear insights to help you protect your body and health, consider subscribing. I share practical, trustworthy advice just like this, and there's a lot more to come. Now, let's look at Viagra, Sildenafil. This is the original ED pill, discovered by accident during heart medication trials. When patients began reporting stronger erections, researchers realized they had something groundbreaking on their hands. Viagra has now been used for decades, with the longest safety record of any PDE5 inhibitor. Here's what you need to know. Viagra is taken on demand, about 30 to 60 minutes before sex, and it works best on an empty stomach. A heavy, high-fat meal can slow absorption and reduce effectiveness. It typically lasts around 4 hours in the bloodstream. Doses range from 25 to 100 milligrams, depending on your doctor's recommendation. Unique side effects? Some men experience a blue-green tint to their vision or sensitivity to light. Others may experience nosebleeds, though that's less common. If you notice color changes in your sight, it's important to stop Viagra and speak with your doctor. Now, let's move to Cialis. Tadalafil. Approved in 2003, it's newer but has quickly become popular. Why? Because it lasts dramatically longer. Cialis stays active for up to 36 hours, earning it the nickname the weekend pill. That means you can take a single dose on Friday night and still benefit well into Sunday. Cialis also offers 2 dosing styles: on demand, 5 to 20 milligrams before sex, or daily low dose, 2.5 to 5 milligrams every day. Daily dosing appeals to men who prefer spontaneity. They don't want to schedule intimacy around a pill. And here's something Viagra can't do. Cialis also treats urinary symptoms of an enlarged prostate, known as BPH. So for men who struggle with both ED and urinary issues, like frequent urination or weak stream, one medication can cover both. Of course, Cialis has its own side effect profile. While vision changes are rare, men are more likely to experience muscle aches or lower back discomfort. So which works better? Interestingly, the overall effectiveness rates are similar. About 60 to 80% of men respond well to either drug, but lifestyle factors make a difference. If you want a short, predictable boost, Viagra might suit you best. If you want flexibility, longer duration, or relief from urinary symptoms, Cialis often wins. And the research supports this. In studies comparing the two head-to-head, men and their partners often reported higher satisfaction and confidence with Cialis, largely because of its longer window of action and the freedom it provides. Imagine being able to enjoy intimacy without watching the clock. That's what sets Cialis apart. Now, let's talk safety for a moment. Both Viagra and Cialis are safe when used properly, but overdosing or combining them with other drugs can be dangerous. The most serious risks include priapism, a painful erection lasting longer than 4 hours, which can damage penile tissue, and very rare cases of sudden vision or hearing loss. These are medical emergencies, and if they occur, you must seek care immediately. But let's be clear, these risks are rare. For most men, these medications are life-changing in a positive way, restoring not just sexual performance but confidence, intimacy, and even relationship satisfaction. So which one should you choose? The truth is, it depends. Some men experiment with both under medical guidance to see which feels better. Others stick with one long-term because it matches their needs. If you try one and it doesn't work, don't give up. Sometimes adjusting the dose or switching to the other medication makes all the difference. And here's something many patients don't realize. Medication is just one piece of the ED puzzle. Lifestyle choices, like quitting smoking, exercising, eating heart-healthy foods, and managing stress, can dramatically improve your results with or without these drugs. So, here's the bottom line. Viagra and Cialis are both effective, safe, and widely used. But the right choice for you depends on your health, your lifestyle, and your goals. Viagra is reliable, quick-acting, and backed by decades of use. Cialis is long-lasting, flexible, and doubles as a treatment for prostate symptoms. The most important step is not just choosing a pill, but understanding your body and working with your doctor to find the safest, most effective path forward. Because when it comes to sexual health, it's not just about performance, it's about confidence, intimacy, and quality of life. And that's worth investing in. Want to gain a clear, comprehensive understanding of atorvastatin beyond a routine prescription? For a professional explanation of its mechanism, patient considerations, a full spectrum of side effects, including muscle pain, liver issues, and even potential impact on diabetes, and crucial medication interactions, check out my video, Atorvastatin, What All Patients Need to Know. What all?